Good morning, students. We are discussing about the excretory system. In the last class, we have discussed about the urinary system, their structure and the function of various parts. As we have discussed that urine formation takes place in the kidney, and kidney consists of millions of structural and functional units, that is nephron, that is also known as uriniferous tubule. Uriniferous tubules having the four major parts, that is Bowman's capsule, loop of Henle, proximal convoluted tubule and distal convoluted tubule. Now see the control of blood composition by kidney. Kidney plays two roles in our body. First is the elimination of waste in the form of urine, and second is the osmoregulation. Osmoregulation means that maintains the equilibrium of solutes and solvent in our body, and through that it maintains the homeostasis, that is the internal equilibrium of our body. Now see the various steps of that osmoregulation. Excretion of nitrogen containing compounds. Basically what happens during the metabolism of a protein, different types of nitrogenous wastes are produced, and that is harmful for the body, and that must be released. In that, urea, uric acid, then creatinine, ammonia, these are the major waste product. Water and electrolyte balance is also maintained by the kidney, regulated by hormones, and that is ADH, antidiuretic hormone, that is released from the pituitary gland, and that helps to increase the water reabsorption. Then second is the aldosterone, that increases sodium reabsorption. Second effect of aldosterone is to increase water reabsorption. Then acid-base balance of blood. Blood pH must be 7.35 to 7.45. Urine pH is 4.5 to 8. Characteristics of the normal urine. Urine consists of water and the other materials that were filtered or secreted into the tubules but not reabsorbed. Normally 1% of glomerular filtrate is excreted as urine. Color of urine varies from pale yellow to deep golden color. Darker the urine, the greater the concentration. Odor. Normal urine is aromatic, has a strong but agreeable odor. Specific gravity. Normal urine has a specific gravity that ranges from 0.003 to 1.030. pH. Normal urine is slightly acidic, that is pH is 6. pH ranges from 4.5 to 8. Protein. Normal urine may have small amounts of protein present, only insignificant amount too small to be detected by reagent strip. Glucose. Normal urine does not contain glucose, and ketones bodies result from the breakdown of fats. Factors that affect kidney function. Antidiuretic hormone ADH prevents excess water loss from kidney. Alcohol inhibits secretion of ADH, more urine volume. Aldosterone prevents excess loss of sodium and water from kidney. Caffeine increases rate of salt and water loss from kidney. Caffeine is present in coffee and the drinks, soft drinks. Increased blood pressure, increased rate of water loss from kidney. Now see the abnormalities of the urinary system. Albuminuria Presence in uric acid of abnormally large quantities of protein, usually albumin, also known as proteinuria. Anuria is the stopping of urine production or urinary output of less than 100 ml per day. Polyuria, excretion of abnormally large amount of urine. Dysuria, painful urination. Ureasis, condition of urinary incontinence, especially at night in bedwetting that is. Glycosuria, abnormal presence of sugar, especially glucose in the urine. Hematuria, abnormal presence of blood in the urine. Ketonuria, presence of excessive amounts of ketones bodies in the urine. Oliguria, secretion of a diminished amount of urine in relation to the fluid intake. Pyuria, presence of pus in the urine, usually a sign of infection of the urinary tract. So, these are the common abnormalities related with the urinary system, and when the pathological investigation goes and if such problems appears, that means in our body some problem is there. That's why doctor advise for the urine test. Pathological conditions. Inflammation of urine bladder, that is characterized by urgency and frequency of urination and by hematuria. Glomerulonephritis, an inflammation of the glomerulus of the kidney, condition characterized by proteinuria, hematuria and decreased urine production. Nephrotic syndrome, group of clinical symptoms occurring when damage to the glomerulus of the kidney is present and large quantities of proteins are lost through the glomerular membrane into the urine. Results in severe proteinuria, also called nephrosis. Pyelonephritis, bacterial infection of the renal pelvis of the kidney. Infection begins in the bladder and travels up the ureters to the renal pelvis. Renal calculi, that is stone in the kidney. Wilms tumor, a malignant tumor of kidney occurring predominantly in childhood. Most frequent finding is palpable mass in the abdomen. Kidney stones. Kidney stones are solid masses of mineral salts deposits that are normally filtered through the kidney and voided in urine. Urine naturally contains substances that dissolves the waste materials that form these solids or calculi. However, when the amounts of these salts are excessive, the urine may be unable to dissolve them all, leaving crystals that accumulate in the kidney and gradually increase in size. Most renal calculi are so small they are pass through the urinary tract without any symptoms. Larger calculi can obstruct the renal ducts or become lodged in the ureters. These larger obstructions cause sharp, severe pain in the sides of the back as they move through a urinary tract. In medical parlance, this condition is called renal colic. The stones can be as small as grain of sand or as large as a golf ball. The size, shape and location of the stones can cause many different symptoms. Renal failure, kidney failure, progressively slow development of kidney failure occurring over a period of years. Late stages are known as end stage renal disease. Treatment of renal failure. Peritoneal dialysis, mechanical filtering process used to cleanse the blood of waste products, draw off excess fluid and regulate the body chemistry when kidneys fail to function properly. Peritoneal membrane is used as a filter. Continuous ambulatory peritoneal dialysis. Dialysate solution remains in abdomen for approximately 4 hours after exchange. Process is repeated 3 to 5 times daily. Advantage: no machine convention for convenient for travel. Continuous cyclic peritoneal dialysis (CCPD) uses a machine that warms the solution and cycles in and out of the peritoneal cavity at every evenly spaced intervals at night while the patient sleeps. Process takes 8 to 10 hours. Last exchange remains in abdomen during the day for approximately 12 to 15 hours. Hemodialysis, process of removing excess fluids and toxins from the blood by continually shunting the patient's blood from the body into dialysis machine for filtering and then returning the clean blood to the patient's bloodstream. Usually 3 treatments a week, 3 to 4 hours at a time, may be performed at dialysis center or at home. So this hemodialysis is helpful for those patients whose both the kidneys are not functioning. And before the transplantation, that patient goes for the hemodialysis till the period of that kidney transplantation. Kidney transplantation, the surgical implantation of a healthy human donor kidney into the body of a patient with irreversible renal failure. Kidney function is restored with a successful transplant and the patient is no longer dependent on dialysis. Donor kidney may come from the living donor, usually blood relatives, or cadaver donors, non-living matches. Kidney transplantation. Donor kidney surgically placed in a iliac fossa. Donor renal artery connected to the recipient's iliac artery. Donor renal vein connected to recipient iliac vein. Donor ureter connected to the recipient bladder. Donor kidney usually function once it is in place. Thank you.